Hi, everybody. Welcome back. Halftime of our high school game of the week. And now it's time for our Medical Minute. Joining me, Dr. Roland Mayer from the Center for Orthopedics. Nice to see you again.
Hi, Mark.
Let's talk about shoulder injuries, in particular, a dislocated shoulder. Talk about that, varying degrees and things.
Well, a dislocated shoulder means that the ball of the humerus, which is the upper arm bone, actually comes out of the socket. The most common, especially in the young athlete, is that it pops all the way out. It can pop part way out. We call that a subluxation. But when it comes out completely, it frequently gets stuck out and needs to be manipulated back. You have to actually pull on the arm. Frequently, you have to give the patient medications to reduce the pain, so we can pull on the arm and pop the shoulder back in again.
Very painful.
The issue with dislocations is whether it happens again. Once it happens, there's damage to the ligaments, and the shoulder then becomes unstable and is at fairly high risk of popping out again, especially in the younger patients.
And what's the difference between a dislocated and separated shoulder?
Well, those terms do actually mean very different things. A separated shoulder is an injury actually to a different joint, the joint between the collarbone and the shoulder blade. And the collarbone will pop up in the air. It's usually caused by someone falling directly on their shoulder, whereas the dislocated shoulder is the ball and socket, which is how the arm is connected to the shoulder blade, and it's an injury to that joint.
Okay. Is one more severe, take longer to recuperate from than the other?
It is more common to have a lower grade separated shoulder. You can have a mild shoulder separation that you can actually recover from fairly quickly. With a dislocation, once your shoulder pops out, it's a pretty severe injury right from the get-go. A subluxated shoulder where the ball slips out partway, that could also be a minor injury and can be treated without surgery and just with a strengthening program as well.
Now, I don't know this for a fact. It would seem like there wouldn't be much to do to prevent these type of injuries. Are there exercises or anything you can do to keep it, at least the rate down from happening?
The separated shoulder, not so much, because that's usually you're landing directly on the shoulder. Other than wearing pads, there's not much to do to prevent that. The dislocated shoulder, you can prevent it somewhat by strengthening the muscles, the supporting muscles around the shoulder, which can help to protect those ligaments that get injured when the shoulder is dislocated.
Very informative, as always. Thank you so much.
Good to be here.
Dr. Roland Mayer from the Center for Orthopedics. That'll do it for our Medical Minute. It is halftime. We'll come back with the second half, our high school game of the week, and it's all right here on MyTV9 and WTNH.com.